Hi, welcome to Professional Certifications channel. Let's break down RHIT exam preparation, one topic a day for focused and effective learning. Today's topic is audit trails.
Definition: an audit trail is a chronological record that tracks all access to and actions performed on electronic health records, EHRs, or other healthcare information systems. The audit trail captures details such as who accessed the system, what data was viewed or modified, when the access occurred, and what changes, if any, were made. Audit trails are critical for ensuring data security, monitoring compliance, and investigating potential breaches or unauthorized access to sensitive healthcare information. Audit trails are an essential component of maintaining data integrity and ensuring that healthcare organizations comply with legal and regulatory standards, such as the Health Insurance Portability and Accountability Act, HIPAA.
Key components of an audit trail. 1. User identification. The audit trail captures the identity of the user, e.g., physician, nurse, administrator, who accessed or interacted with the healthcare system. This may include user IDs, names, or other forms of authentication, e.g., biometric data. 2. Timestamp. Every action recorded in the audit trail is time-stamped to indicate the exact date and time the action occurred. This helps in creating a clear timeline of events and ensures that access and changes to the system can be tracked in real time. 3. Action taken. The audit trail records the specific actions performed by the user, such as viewing, modifying, deleting, or creating data. For example, it tracks when a user opens a patient's medical record, updates clinical notes, orders tests, or changes billing information. 4. Data accessed or modified. The audit trail specifies which data was accessed, viewed, or modified. This could include patient health records, lab results, diagnoses, billing records, or administrative data. In cases where data is modified, the audit trail may also capture the original data and the changes made. 5. System or location of access. The audit trail often captures the device or system from which the access occurred, including IP addresses, workstations, or remote access points. This helps identify where the access took place, which is especially important in identifying potential unauthorized remote access. 6. Outcome of action. In some cases, the audit trail may include the result of the action, such as whether an access attempt was successful, denied, or resulted in an error. This helps in monitoring failed access attempts, which could indicate a security risk. Importance of audit trails. 1. Security and privacy monitoring. Audit trails play a vital role in maintaining the security and privacy of electronic health information. By tracking all access to patient records and healthcare systems, audit trails help detect unauthorized access or suspicious activities, ensuring compliance with privacy laws such as HIPAA. 2. Compliance with regulatory requirements. Healthcare organizations are required by HIPAA and other regulations to implement audit trails to track access to patient information. Audit trails help demonstrate compliance with these regulations and provide a transparent record of how patient data is handled. 3. Data integrity and accuracy. Audit trails ensure the integrity of health information by recording all changes made to data. If errors or unauthorized modifications occur, the audit trail can be used to identify the source of the changes and take corrective action to restore accurate information. 4. Accountability. By logging user activity, audit trails create accountability among healthcare staff. Employees are aware that their actions are being monitored, which can deter improper behavior, reduce the likelihood of privacy violations, and ensure adherence to organizational policies. 5. Legal protection. In the event of a legal dispute, such as a malpractice lawsuit or privacy violation claim, audit trails provide a detailed record of who accessed the patient's records and what actions were taken. This information can serve as evidence to support or refute claims of improper access or tampering with medical records. 6. Incident investigation. Audit trails are essential for investigating security incidents, such as data breaches, unauthorized access, or system malfunctions. By reviewing the audit trail, organizations can determine the root cause of an incident, identify responsible parties, and implement measures to prevent future occurrences.
Types of audit trails in healthcare. 1. User activity logs. These audit trails capture information about the actions performed by users within a system, such as logging in, viewing patient records, making changes to data, and logging out. User activity logs are crucial for tracking who accessed the system and what they did while using it. 2. Access control logs. Access control logs focus on recording access attempts, including successful and failed login attempts, access denials, and attempts to access restricted or sensitive data. These logs help identify potential security risks or unauthorized access attempts. 3. Change logs. Change logs document modifications made to data, including the original data and the changes made. These logs are particularly important for tracking changes to critical information, such as diagnoses, treatment plans, or billing records, and ensuring data accuracy. 4. System event logs. System event logs track system-level activities, such as system startup, shutdown, software updates, and system crashes. These logs help identify technical issues and ensure the system is functioning properly.
Legal and regulatory requirements for audit trails. 1. HIPAA, Health Insurance Portability and Accountability Act. HIPAA requires healthcare organizations to implement technical safeguards, including audit trails, to protect the privacy and security of electronic protected health information, EPHI. Under the HIPAA security rule, covered entities must maintain audit controls to record and examine access to EPHI and ensure that any unauthorized access or tampering can be detected. 2. HITECH Act, Health Information Technology for Economic and Clinical Health Act. The HITECH Act reinforces HIPAA's privacy and security provisions, particularly concerning electronic health records, EHRs. It promotes the adoption of health IT systems with robust audit trail functionality to enhance data security and patient privacy. 3. The Joint Commission. The Joint Commission requires healthcare organizations to maintain audit trails as part of their accreditation process. Compliance with the Joint Commission standards includes ensuring that electronic health information is appropriately monitored, secured, and accessible for audits. 4. CMS, Centers for Medicare and Medicaid Services. CMS mandates the use of audit trails in healthcare systems that manage Medicare and Medicaid patient data. Audit trails help ensure that patient information is protected and that healthcare organizations meet CMS's regulatory and reimbursement requirements.
Challenges in implementing and maintaining audit trails. 1. Data volume and complexity. As healthcare systems generate large volumes of data, managing and analyzing audit trails can become complex. The vast amount of user activity and system events tracked by audit trails requires efficient data storage and management solutions to ensure that the information is readily accessible for monitoring and reporting. 2. Security of audit trail data. Audit trail data itself must be protected from tampering, unauthorized access, or deletion. Healthcare organizations must implement safeguards, such as encryption and access controls, to ensure the integrity and confidentiality of audit trail data. 3. User access to audit logs. It is essential to restrict access to audit logs to authorized personnel only, as allowing unauthorized individuals to view or modify audit logs could compromise security and undermine the purpose of the audit trail. 4. Real-time monitoring. While audit trails provide a detailed history of user activity, real-time monitoring of audit logs is essential for detecting and responding to suspicious activities promptly. Implementing tools that can analyze audit logs in real time and trigger alerts for potential security incidents is critical to maintaining data security. 5. Resource allocation and cost. Implementing robust audit trail systems requires investments in technology, personnel, and infrastructure. Healthcare organizations must allocate sufficient resources to maintain, monitor, and analyze audit logs while ensuring compliance with legal and regulatory requirements.
Best practices for audit trails. 1. Implement role-based access controls (RBAC). Ensure that only authorized users have access to specific parts of the healthcare system based on their roles. Role-based access controls (RBAC) limit access to sensitive data and prevent unauthorized personnel from viewing or modifying protected health information. 2. Conduct regular audits and reviews. Regularly review audit logs to identify patterns of suspicious behavior or potential security risks. Conducting audits helps organizations ensure that their systems are being accessed and used appropriately, and that any deviations from normal activity are investigated. 3. Establish a data retention policy. Develop a clear policy for how long audit trail data will be retained and ensure compliance with legal and regulatory requirements. Data retention policies help manage storage resources and ensure that audit trail data is available for investigations or legal reviews when necessary. 4. Utilize automated monitoring tools. Use automated tools and software to monitor audit logs and flag suspicious or unusual activities. Automated monitoring can help healthcare organizations detect potential security incidents in real time and respond quickly to minimize risk. 5. Ensure data integrity and security. Protect audit trail data by implementing encryption, secure storage, and access control measures. Regularly back up audit trail data to ensure that it remains intact and accessible in the event of a system failure or data breach. 6. Provide staff training. Train healthcare staff on the importance of audit trails and data security. Ensure that employees understand how their activities are monitored and the role they play in maintaining patient privacy and adhering to organizational policies.
Future trends in audit trails. 1. Advanced analytics and AI integration. Artificial intelligence (AI) and machine learning technologies will increasingly be used to analyze audit trails and detect anomalies, such as unusual patterns of access or data manipulation. These technologies can identify security risks faster and more accurately than manual methods. 2. Blockchain for tamper-proof audit trails. Blockchain technology offers the potential to create tamper-proof audit trails by recording every access and transaction in an immutable, decentralized ledger. This can enhance the security and transparency of audit trails in healthcare systems. 3. Real-time data auditing. The demand for real-time auditing and monitoring of user activity will grow as healthcare organizations continue to face cybersecurity threats. Real-time audit tools will enable organizations to detect and respond to unauthorized access or breaches immediately. 4. Integration with interoperability standards. As healthcare systems become more interoperable, audit trails will need to track the movement of patient data across multiple systems and organizations. Ensuring that audit trails are compatible with interoperability standards, such as FHIR, Fast Healthcare Interoperability Resources, will be essential.
Conclusion. Audit trails are a critical component of healthcare information systems, providing detailed records of access to and actions performed on electronic health data. By tracking user activity, ensuring compliance with privacy regulations, and supporting security investigations, audit trails help healthcare organizations maintain data integrity, protect patient privacy, and meet legal obligations. For RHIT exam aspirants, understanding the purpose, challenges, and best practices for audit trails is essential for supporting health information management and ensuring the security of patient data.